Just quickly to go through the agenda, and then we'll get underway and try to make a very good use of your time today. We do have some updates on index development, where we are in the process, what steps are being taken, as we discussed in our orientation meeting last month. There's a lot of methodological and modeling work going on around the index, so we want to make sure that you are in the loop on what that work looks like and where we are in that process. Want to update you on the use, usability, and usefulness survey. We had mentioned that on our last call, and I believe we mentioned that we had hoped to have you pilot test that by now, but we haven't quite gotten that ready for prime time, so I just want to give you an update on that. Then we'll go through the index timeline, and since this is the engagement and communications work group, we'll focus primarily on opportunities we have identified, some of which we've taken advantage of and some of which are on the calendar already, to engage existing and new stakeholders. And then we're going to have a little bit of discussion around the website that will be led by Kathy and Kathleen Kimball Baker, and we just want to sort of get an overall sense of your impressions as engagement communication team members, of your impressions of that website as it stands now. And on the line also listening in will be Emily Friedner from Homefront Communications, who have been designing the website. And I believe I got great news yesterday that the phase 2 work is just about ready to launch, so we can really start digging in and visiting the pieces of the website that need additional development. So we're really looking forward to getting your feedback on those areas. And then we'll open the floor for questions, and then we will let you get back to your days. So thank you again for being here. I'd like to quickly run through the work group attendance and see if there's anyone on the phone who's perhaps who we don't see on the login on screen. Kathy Slimp, I just heard from. Garrett, is Garrett here, or is Jennifer representing Garrett, or are you both here?
Hi, Anna. This is Jennifer. I'm actually representing Garrett today.
Thanks so much. I see Laura from NACHO is on the line. Kelly DeGraff. I didn't think Kelly would make today's call. Doug Farquhar?
I'm here.
Hi, Doug. Thanks for joining us. Andrew Jahir?
Hi, I'm here.
Hi, Andrew. I see Kathleen logged in. I see Mary Lanehos logged in. I believe Liam is out of the office this week. Liam? Okay. I see John Osborne logged in. Mary Davis is logged in, as am I. And Michael Childress, our program manager for the index here at the University of Kentucky, is also on the line. And he may be able to answer any specific questions you have related to the methodological and modeling work in just a moment. Did I miss anyone? All right, great. Thank you all so much for being here again. As I mentioned, we talked a lot about some of the evolution of the index in terms of the methodological approaches, the modeling, statistical analyses that we have engaged in at the University of Kentucky since the index moved over to the Robert Wood Johnson Foundation from CDC back in January. Those processes have included some validation analyses, some statistical analyses to help us identify candidate measures that might not be in the right subdomain or domain, to look at that mathematically, and also to look mathematically at measures that might be candidates for discontinuing. And those candidates for discontinuing in the index relate to a number of potentially problematic areas. Either they're infrequently updated, there might be a low item to scale correlation in some of those statistical analyses. There's no variation across states. Everyone's a yes or everyone's a no, and they're composite measures. Now these candidate measures for discontinuing are not put up as a candidate measure simply because it meets one of those criteria. These candidate measures meet multiple criteria. While running those analyses on the existing index, and you'll remember there are more than 170 measures in the index, some of those being composite that's leading to more than 190 actual data points in the index. So we've got this call for measures that we ran in the spring where we elicited 50 to 60 new measures, and these come up from a variety of sources that you can see on your screen. They also relate to a variety of domains or subdomains, some of which are areas that we have not had enough measures in yet to light up, as Kathy likes to say. So we've sort of grayed out some areas and haven't been able to include them yet, but we're looking to light up some of those subdomains that haven't quite come online yet. So we have these 50 to 60 new measures, plus we have some candidate measures for discontinuing. So one of the ways that we are going about determining what measures go in the next index and what measures do not go in the next index is by fielding an expert panel and Delphi process. And that will be conducted online with invited participation from experts in a variety of areas who will be looking at the measures, at the subdomains, and at the domains, and they'll be not only examining how important the measures and the way they fit together in the index are specifically, but also how they address the all hazards approach, not risk-based. I think we discussed in our last meeting that the index right now is an all hazards index, and that someday we would like to have some communication tools that maybe allow for folks to do within that all hazards approach, look at some risk-based assessments. But for right now, it is an all hazards index, and it is going to remain that way in the next year. So I'm going to turn over to Mike, if he wouldn't mind just saying a few words about this Delphi process that we're getting ready to engage in.
Thank you, Anna. We've had several meetings about this in the two other work groups, the analytic methodology and the model design work groups. Actually, for the last 2 months, we've discussed this. And so it is centered really around how do you set this up? And I think that Anna touched on it when she talked about the all hazards approach. As you know, there are a lot of different risks. You know, Kentucky does not face the same kind of risks or hazards that, say, California, Florida, New York do. And so one of the issues is how do you frame this to the Delphi experts in such a way that you cast a wide enough net, you make it broad, but you don't make it too broad. You want it to have some meaning, some teeth. And so we're working to try to carefully craft the language on how to do that. Once you set the table, then we have a series of visual analog scales ranging from 0 to 10 with a slider so that the expert can indicate how important or how relevant. You know, here I'm struggling for the right word because, again, this has been another topic of conversation in these work groups is what kinds of, how do we want to characterize this? The way that we went into it was that we were talking about how well a particular item measure corresponds to the overarching subdomain. Really going to be a three-wave effort, with the first effort focused on the item measures and how well they fit within a subdomain. And so do you talk about it in terms of how well items correspond or how important or how relevant? And again, we're still working through that. The other item is, who are your experts? And so we've actually gotten pretty good input about that, thanks in large part to this work group chair, Kathy Slimp. Kathy, thank you so much for really providing a lot of names, and I think that stimulated a lot of action among other people. So that's been outstanding, and I really appreciate that. And the final thing is that we're working to get this approved through our institutional review board here at the University of Kentucky, so that ultimately we can get this published in a referee journal, and that all the I's are dotted and T's are crossed and it's squared away nice and neat. The idea is to get the IRB in place and processed, probably take through August, and to field this thing in September.
Thanks so
Mike
much.
and Anna, this is Kathy. That's a great summary. I'm wondering, Anna and Mike, if there's any particular roles that you think could be helpful for this work group that we could help you with in terms of either anything with the Delphi panels or in looking at some of the feedback that you receive, or just trying to, and there may not be, I know that's more the model and methods, but I'm just wondering if there's anything that we might be able to offer for you in either the process or the results, or turning those results into implications for the next index, or those kind of things. Just would open that up as a possibility.
So
Go ahead.
So I would say, Kathy, that of course, you've been involved in a lot of these work group conversations. One of the things that a possibility would be that as we beta test this instrument, we want to put it in front of people before we send it out to our experts. And so there, you and others, actually, Kathy, we've got you penciled in to be one of the Delphi experts, but you might be able to suggest to people, or you might want to yourself act as one of the beta testers from a communications perspective. How well does this thing come across? I mean, does it make sense?
Sure, that'd be great. And I would say if there's others on the work group that would like to look at it from that communication standpoint, I think we'd be open to just let us know, and we'd love to get input, I would think. You wanted to look at it from the perspective of your audience.
Absolutely. And I think that we'll definitely talk here about how we can give everyone on the committee, hopefully, the opportunity to weigh in that way in the beta test phase. I think that would be very useful to hear how it's reading to a variety of folks from a variety of perspectives. I would also encourage the folks on the line, if you find this process interesting or you're intrigued and really want to dig down deep into how this is evolving, this work around the Delphi process and the methodological work, to visit the website. And I know we're going to talk about the website in a few moments, but the website does have archived slide presentations from past methods and models work groups. It does have links to the monthly work group meetings, and I would also mention that all of those work group meetings are open. So if you would like to attend any of those, they are open, and we'll provide the dates for upcoming work groups at the end. So we would love for you, if there's something that you find particularly intriguing and you really want to hear about or you want to weigh in on, please feel free to attend those meetings. That said, does anyone have any pressing questions about the process while we're on the line now?
Mike, are you still looking for Delphi panelists? I mean, we can just share with the group here that the way you're setting those panels up is by the domains, is that right? And if any of them have knowledge of experts that they think would be helpful to put on that possible list of domain experts, would that be beneficial?
Absolutely. It would not only be beneficial, it is encouraged and would be greatly appreciated.
So if you all know, if you all got areas, folks that you know in your own circles that would be really, you think offer really key input to the domain-specific areas, how should they send that to you, Mike, or Anna, or what's best?
Well, you can send it to either one of us. I think it would, I'm the one that's collecting it. If you send it to Anna, she's going to send it to me. So probably the best thing would be to send it to me.
Great. Yeah, that'd be great if folks reach out.
I would also say self-nominations are encouraged.
Yes.
Yeah, absolutely.
If you look at the domains and the subdomains and you say, really, I've done a lot of work in this area, I might have something to offer to the process, by all means, send that in. What it may mean is that you don't end up beta testing. If you're on the final expert panel, you may not end up in the beta test group, but we're going to snag you one way or the other. So please feel free to self-nominate for that.
That'd be great. Thanks.
Any other questions related to the index development to date? That was a great job, Mike. Thanks so much. Moving forward, because I know we want to leave a lot of time for our discussion of the website, I wanted to update folks on the use, usability, and usefulness survey. As you know, we are interested as a work group and as a new program management office at looking at how the index is being used, how it might be able to be used by existing and new constituencies in ways that it isn't right now, how usable the current presentation of the index is, and how useful folks perceive it is for their work right now, and how we can improve on all of those those scores. So we have been developing the survey, working with Mary Davis, Kathy Slimp, and Kathleen Kimball-Baker, and I have been hammering away at the first version. We will be talking to the Robert Wood Johnson Foundation about the latest set of adaptation very soon, and hopefully get that through IRB for fielding widely in the next month or so. But in the meantime, what we're hoping to do is pilot this survey in much the same way Mike's talking about piloting, beta testing the Delphi survey. We'll want to beta test the use, usability, and usefulness survey with our existing work groups and our National Advisory Committee, and that will allow us to gather some data, not only to see to what extent the instrument itself is working, or if there are any clarifications that need to be included in the instrument itself, in the survey instrument. But it will also allow us to gather some baseline data on folks who are already in some way engaged in the index. So you guys will be piloting the instrument, but also giving us some real honest feedback about areas that we need to think about as we continue looking at better ways to engage and communicate the index to a variety of constituencies. So our current plan is hopefully in the next couple of weeks to get you guys the pilot survey, along with the models work group, along with the analytic methodology work group, and along with inviting our National Advisory Committee members to participate in the survey pilot. And while that is in the field, we will be shepherding it through the IRB process so that we can do a broader fielding of the survey instrument to really sort of look at 4 different groups who are implicated in the index and its usage. And those groups are in public health, particularly state and local preparedness directors, the emergency management, county, state, and federal levels, preparedness coalitions and hospital preparedness program stakeholders, so that we can reach into hospitals, community-based organizations, and businesses, and preparedness researchers, including the CDC PERCs, Hurricane Sandy researchers, the NIEHS Disaster Research Response Environmental Health Network, those kinds of groups, so that we can gather data from all of them on how useful they feel the index is in their work right now, and how we might be able to improve usefulness for them. So we're hoping to get that in the field about the time, hopefully the end of August, the beginning of September, about the time we're finishing up with the pilot run. And we will be able to write a report on the pilot data that you guys and the other work groups and the NAC contribute to. And that will give us some grounding for going into the work with setting the website up for the next iteration of the index. December, January of this year. We'll have some baseline data, and then we'll run the wider survey for a month, and then we'll aggregate that data and see what it tells us that may be different, because some of these folks are less engaged with the index right now than many of you on the phone. So it will be really an opportunity for us to compare those groups in some ways. So that's the plan. For the use, usability, and usefulness survey. You should be seeing links in your inbox in the next week or two. Are there any questions about that work right now? Okay, hearing none.
I'll just show a thought out, which is when we did the surveys in the past, we really were just reaching out to various audiences that we could tap into on a kind of fairly quick time basis. And I have to say, it really is nice to, and I think Barbara Johnson's and your all's methodology groups have really taken the time this time to really be able to do a more methodologically sound survey, which I think will be nice to do that, and something that hopefully we can use again over time to track progress. So it's nice to see those take a next step. Even though I know it takes a little longer, it's nice to see a next step evolve in some of those feedback surveys.
Thanks so much, Kathy. And that's one of the reasons we're doing the staged approach as well, because doing it that way, doing the piloting data, that gives us an opportunity to really have some data. We may not have all of the data we want, but it gives us some data to begin conversations with Emily and her team at Homefront as we start thinking through the next iteration of the index. Terrific. All right. You all should have received a copy of the index timeline just to brief you on the work that has been done so far this year and the work that is forthcoming in terms of engaging various audiences. Kathy very nicely went through that and segregated out to help understand what our internal activities are and our external activities. That being said, our work groups are, I think I mentioned this in our last call, our work groups are specifically designed to draw from a variety of sectors, and we hope that you all will help us reach existing and new stakeholders in your gatekeeper role to those communities as well as we move forward. So our work group meetings are largely internal events, but in some ways they're a little bit on the external side because we're also looking to you as important knowledge brokers for the folks you're working with. You can see here in Q1 of the external activities and events, we obviously launched the new website that we asked you to have a look at this week if you had some time. And we did a presentation for the NACCHO Preparedness Planning Outcomes and Measurement Work Group. February was a little quieter externally as we began fielding our National Advisory Committee and having that meeting. In March, CDC did a very nice article in their Public Health Security Bulletin. Stephen Redd, who is one of our National Advisory Committee members, wrote that we had a listening session with ASTO's Performance Evaluation and Improvement Work Group, and we did some presentations down at CDC for the Hurricane Sandy Recovery Research Initiative and for the CDC Board of Scientific Counselors. Moving into Q2, we did a panel. Kathy and I joined Alonzo Plow, the Vice President at RWJF of Research Evaluation and Learning and Chief Science Officer, Jim Craig from Mississippi, and why is the name Jim Blumenstock from ASTO? Thank you. Just drew a blank for 2 seconds. On this Preparedness Summit panel, we had, what do you think, Kathy, about 50 folks in the room, 50, 60?
Yeah, probably it's close to that, yeah.
And we were able to talk about the index, in the past, present, and future of the index. We recorded an HO podcast interview that I don't think has gone live yet, but expect to at any time. And then we took advantage of some networking opportunities to talk up the index at the Keeneland Conference in PHSSR. In May, we launched an index listserv that includes all of the names of everyone we know has been involved in the index to this date, as well as some folks who have indicated interest. So if you aren't getting that index listserv at this stage, please shoot me an email after the call so I can make sure that you're on the list. You should be, but just in case. It's always good to have a backup plan. We also, in June, took advantage of an opportunity to talk to some environmental health scientists at a workshop at Purdue. And you can see on the left side activities like the Delphi survey development. We recorded video interviews with NAC members that will be posted to the website in phase 2 of the Homefront work, those kinds of activities. Moving into Q3, this month we spoke at the Council of State Governments Midwest Legislative Meeting. We had about 50, 60 folks in that room, elected officials from the Midwest. It was a good group. We sat with the Chief Health Officer for North Dakota and some CDC representation on that panel, and that was a really good group. Listserv continues. In August, we're hoping for the use, usability, and usefulness. We've abbreviated that as U3 survey to launch. We're also coming up on the Hurricane Katrina anniversary, so we're looking to tie in some communications RWJF may be doing about that with the index to drive some traffic, reciprocal traffic, so to speak. Continuing with listserv updates, we're going to have a listening session and formal presentation. Jennifer kindly invited us after last month's meeting to speak to the DPHP Executive Committee in August, so we're looking forward to that conversation. September, we're planning the Delphi survey launch. Moving into Q4, we have another listening session. Perhaps we're going to be presenting at the DPHP meeting in Arizona, and then we're going to take advantage of the APHA annual meeting to talk up the index. I also think that RWJF is going to be playing a role from the dais at that meeting, so I'm hoping that they will take the opportunity to provide a mention or two while they're doing that. Then there is the Dissemination and Implementation Conference coming up in December. We're looking at launching the next iteration of the index in January so that it can be the 2016 index and be new all year, as opposed to launching it in December and calling it the 2015 index and then it's new for a couple weeks. We're still working through the ins and outs of doing that, so stay tuned. We'll let you know as that changes. Big questions that we have about the timeline are what are we missing? What are the big meetings, the big opportunities to engage, or even the little opportunities that could provide big opportunities to engage that we are missing from this list and should be pursuing? And we do have a variety of folks from a variety of areas on here and would welcome any insights you'd like to share. And if you can't think of any at this particular moment, then by all means feel free to shoot us an email after the call and we'll assemble all of those. Yes?
Did you do outreach to NEMA? Did I miss that?
I don't have anything on here for NEMA at the moment.
Have you talked to them?
I need to check. I don't think we have. I think we may have a representative on one of the other work groups, but not in a formal way as yet.
When is their meeting this year? I was thinking about the same. Do you guys know? Or Andrew, do you know?
Let me look here. NEMA annual meeting.
Yeah, I don't have that information. It just seems like they would be a very natural constituent.
Yeah, and they've done some work. I know. ASTO in the past has linked with them, and they've been active with things. But that would be great to link more formally into that one.
Absolutely. It looks like their meeting is in November 4th through November 6th. Let's see. Absolutely. So we'll put that down as an opportunity to engage, perhaps, and check into that.
Now, the other one with emergency management might be IAEM, International Association of Emergency Managers. I don't know if that's another one to look at.
Okay.
And Aaron on one of your other work groups has a link to that group, I think.
Terrific.
Aaron Sutton. What are other ones that people see that you think would be really important, the meetings you know coming up, or anything in the healthcare arena, or what other ones would be really key?
Anna, this is Mary Lane.
Hi, this is Kathleen, and I was just, this might be a little bit out of the scope, but in case you're interested, there's a Continuity Insight meeting. That's their annual Continuity Insight Management Conference. It's mostly businesses that are involved in business continuity, and that's in April 20th to the 22nd in Arizona. But that group is highly engaged in preparedness kinds of issues, and it would probably be very interested in learning about the index.
Excellent. Thank you, Kathleen. Did I hear Mary?
Yeah, can you hear me?
Yes.
Okay, great. This is Mary Linehurst. So I think I mentioned this to Glenn previously, and hopefully somebody from the index is already planning to attend, but in New York City in August, on the 9th and 10th, ASPR is hosting a conference to feature the Hurricane Sandy research projects that are sponsored by CDC, NIH, and ASPR. So at least the first day and a half of the conference, I think, is open to the public and anyone who's interested in attending. So anybody that's in the New York area, you're welcome to attend, and it's certainly a networking opportunity with all of the Sandy investigators, as well as the program officials from those agencies. And there's been a push to get a lot of folks from the practice community there, so there may be kind of an opportunity to do a little bit of marketing.
Terrific. Thank you, Mary.
Yeah, and I can contact Marcy Wright at ASPR if you know her, if you're interested in trying to, get some sort of a role, or I can connect you. And anybody else that's interested, there's information on ASPR's website, and I can point you to that if you are interested in the conference.
That would be terrific. Thank you so much. This is a great list. Other thoughts folks are having?
What about anything in healthcare? What meetings are coming up that folks know about with that, or opportunities or newsletters, or... This is Kathleen again. I was just looking at the American Hospital Association annual meeting dates. Would that be useful at all? I mean, those are in 2006. They list several, but I don't know what their specific, agendas are. So there's like May of 2016, May 1 to the 4th, May 7th to the 10th, and May 6th to the 9th. So kind of overlapping. So I don't exactly know what that means, but just tossing it out there.
Terrific. Thank you. I think we just lost Dawn, who had to run to another meeting. So our healthcare, that's why we're not hearing anything on.
Gotcha. That makes sense.
I was thinking to jump away to another meeting. Other thoughts?
Yeah, this is Mary Linehost again. As far as the healthcare community and some public health practitioners, at CDC we have a clinician outreach communication activity that is a webinar, and they have a really huge distribution list with a number of professional associations of like 40,000 people, and they do concerted marketing. So one thing we might be able to do is put together a webinar talking about the index for that audience when it's appropriate to do so. So it might be helpful to have like a case study, showing how the index could be helpful, or alternately kind of describing the goals of the index and trying to recruit folks from those sectors to participate in developing measures for the index. So that's something we can explore.
It's a great idea. Yeah, the COCA webinars are interesting, and they do reach a large audience.
Yeah, so I have a connection over there if you're interested in looking into that.
Great. So we've got NEMA, we've got IAM, we've got Continuity Insight, we've got the ASTO Future of Sandy research, we've got AHA, we've got CDC Clinicians Outreach Communication Activity. Others?
Sorry, did you mention the Healthcare Coalition conference that's going to happen in December? That would be a good one.
Excuse me while I write quickly. All right. Anything else?
There's Academy Health, so their big research meeting was in June. I think they have some other smaller meetings. They might have a policy meeting or something some other time of the year, but that might be another opportunity to engage with the various stakeholders.
Mm-hmm. And we typically have a presence at Academy Health, and I know Glenn did some networking back in Academy Health in June, Minneapolis, right?
I think so, yeah. Great.
Excellent. Excellent. And they are co-hosting the Dissemination and Implementation meeting in December that we've flagged as another opportunity for networking and promotion too.
Yeah, good.
Well, this is a great starting list, and as you continue thinking about this and ideas occur to you, please shoot us an email and say, oh, I just thought of this meeting would be great. this webinar series would be great. Whatever space we might be able to move into to help raise. All right, so that's our timeline. But I wanted us to, I was hoping we could spend about half the call, and I'm getting ready to turn things over to Kathy and Kathleen Kimball-Baker to really guide us through your discussion about the website. And we had asked over the weekend if folks had an opportunity to spend a few minutes there and think about how you might be able to use, think about looking for information for a report or a presentation, what kind of information you would be looking for, how easy was it to find, those kinds of questions. And these were the guiding questions that we provided in that email. So I'm going to turn things over to Kathy and Kathleen and ask them to take us through this discussion.
Sure. Thanks, Anna. We're actually really excited about hearing from you all, and this will not be a one-time thing. We'll certainly want to do this further as we have a chance to in future calls. But RWJF and Homefront really had to do that first design of the website, pulling together a lot of material in very new and different ways. And so they really worked hard and have launched that, as you've seen. And so now an opportunity for feedback and getting to really shape that for several reasons. And I think you all can really offer that first real glimpse back in terms of feedback, both for helping to begin to think about how we want to adapt and plan and refine the site moving towards the 2016 launch. And also, I think issues that you raise can help inform the U3 survey and the focus groups that Anna's got planned in terms of looking at things more closely. Look at identify areas that can we need to delve deeper into and to look at that. I know it went out, the request went out just over the weekend, hasn't been a long time. So let me first start, just get a feel for who's had a chance to take a look at the website. And if you haven't, we understand that. And we can carry this over into our next call. But how many folks had a chance to sit down with the website and the kind of sample questions, just even roughly? That's on the call now. Where were folks with that? We understand the answers. I didn't get to it.
Kelly, this is Jennifer with that. So I just got the information yesterday, so I haven't really had a chance to look through it, but I'll do the best that I can to give you guys some feedback from what I have. Great. Anybody else that had a chance to spend time with it or didn't get a chance to?
This is Mary Linehost. I also got the message yesterday, so I haven't had much of a chance to poke around on the website today and look at the specific questions you asked, although I'll be happy to do so and send feedback. I did poke around on the website back in, I'm going to say February maybe, when I first connected with Glenn and started looking at some of the things. Has the website changed much over the last few months?
No, I think it's probably very similar. Is that, Anna, any changes that you know major?
No, there haven't been any major changes since the launch of the new website back in January. So if you even if you haven't had a chance to spend any time on it in the last day or so, but you did have a chance to spend some time on it either back when this iteration of the index launched, or perhaps when you received the invitation to join the work group and you were trying to figure out what it was all about, any thoughts you have about that experience of visiting the website, I think we would welcome.
Absolutely. Anybody else get to spend some time with it? Somebody may need to come back to this some too, and I mean we can certainly have some quick discussion now, and maybe we can come back at our next call and really do some more in depth. I'm wondering, and folks have had more time to do that. But just based on, maybe we can have some discussion here now. From if you've looked at it in the past over when you first got introduced to the index, or working up to this point. What I would like to do is just kind of open up to some kind of preliminary kind of round robin in terms of perspectives as you look at it, and your initial impressions or general thoughts from your constituency's perspectives. And maybe that will be simply Is it, were you able to find things that intrigued you or that would be beneficial to your audience? And did you find it useful or usable? Both of those. Kind of do a little bit of some feedback in terms of how you found it along those lines. That might help us inform some issues to kind of explore more fully with that as well. So, and we're going to just kind of listen and capture thoughts. Kathleen has offered to take notes for us and to kind of synthesize feedback that we hear at the end for us, and then maybe we can go through some more specific questions as they arise. But let me open it up first, and just from if you could share with from your audience's perspective what your audience would be, and kind of your initial impressions in working with the index or looking at it from the angle of if you're using it for your constituency, and go from there. So I know Jen and Mary, you mentioned you've done some exploration on it. Any particular thoughts you would like to share or others might chime in on?
So this is Jennifer. Go ahead.
I was just going to say, and Mary and Jennifer are in an interesting position because the website is, the history of the index has largely been targeted to particularly Jennifer's constituency. So their perspectives, it will be nice to see how their perspectives align with how well we're meeting those goals.
Yeah.
Well, this is Jennifer with ASTO. So I had a little bit of an opportunity to look at it, and I do like how it has changed. And when you go to the first landing page, it talks about planning for today, for tomorrow's health and safety, and then how prepared are we in 2014. So I do like the headings, the index. So I think that gives people a little bit about an index, like what the index is, and then measuring preparedness, and then behind the index. I'm wondering, so under tools and resources is where I noticed that there's a lot of resources that are available, particularly for state health agencies and local health departments to, get the information out there to their constituents about, what is happening with this and how to use the index. I'm wondering if there's a way to kind of spell that out, that, if states were looking for tools and resources, they wanted to go right to their state. Would they be able to do that by just, clicking on that state map, or is that the intention of that?
So it wasn't clear from the home page, in other words, in terms of how to kind of get to your particular state information, making it more readily linkable there. Is that what I'm hearing?
Well, if you go to the landing page itself, I guess I'm presuming if you click that little map, and you can see the index, see the state profiles. But if you're looking at the major headings under the logo piece of it, the index, measuring preparedness, behind the index, and tools and resources, I just was kind of going through each one to kind of see what information was put where, and I just thought the tools and resources, I don't know if there's a way to, indicate that those are resources that can be used to kind of help communicate the index, and the use of the index. I think that was a little unclear to me until I actually went in there to navigate each thing.
Yeah, and there's not as much drop down there as there are, in other words, in terms of the other ones that kind of more guide you.
If you did roll over and you put a drop down, you say tools for communication, that type of thing, that might be a little bit helpful.
Mm-hmm. Yeah.
So tools for whom are the big question is, for whom are the tools developed and how can they be used? A little better, perhaps better organizational signposts. Is that kind of one of?
And also when you go under measuring preparedness and behind the index, you can actually scroll down. It's kind of got like a little drop box. If you roll over it, you can go down it. It would be helpful if you had a list of some of the resources that are available and kind of spelling out what they are. So this way, it's not, you have to physically click in there to find what you want. So I think if you were able to have something where the drop-down thing where, you spelled out some of the things that are available, like communication tools, that type of thing, that would be really helpful, I think.
Great. Thank you.
This is Emily. Can I just jump in on that quickly?
I think that's a great idea. The one thing that I'll mention is that on the other tabs, those drop-down items are for like navigational purposes. So the one thing that we would have to think about if we added drop-downs to tools and resources is sort of anchoring that page in a different way so that if someone did click on a drop-down, they would be taken directly to that information. So right now the page is just sort of existing as one page, so we would probably have to restructure that in some way if we wanted to bucket those resources a little bit differently, if that makes sense. Just something to think about additionally there.
Sure, and you know,
make a lot of sense, Emily, particularly around the things like work group slides. You know, we would like to have a home, as we've discussed in the past, for the slides and recordings of various work groups, and so those kind of need a landing page. So as we're thinking about building out those pieces, and those would be included in tools and resources, I think it makes sense to think about how we might split that up.
Yeah.
and one of the things that's really nice about this work group, and I should have said this up front too, you know, is we have an opportunity to really see it from the community perspective firsthand. And so it's really nice to just kind of listen to you all, and then there may be issues of how we structured or what's behind the scenes that we need to come back and say, okay, here's the pros and cons with that, or here's the issues, help us problem solve it. But just kind of getting on the table the issues that first strike you when you come, because you can kind of be that user group at the beginning that we know all the details behind it, which makes it challenging for us to see those new things. And so things like what you did bring up, Jennifer, is really helpful to hear. But you're right, as Emily brings up, there's nuances of how we have to wrestle with those things, and the pros and cons of how we might actually implement it. So it's really helpful.
When I look, open up this and get to the results, I'm just kind of curious here. You don't really give the range of result, and well, you do, but it's between 2 and 10. So I think one of the things I kind of discovered is it seems like that these results can get skewed. If you have a very good result on one issue and terrible on everything else, you can end up in the mid-range without really bringing forth the issue that you're only good in one area and you're lacking in everything else. I just was wondering if these results are somewhat skewed because of that.
And are you talking about with a state result?
Yeah.
In a state like across the subdomains and domains. Is that right?
Yeah.
Yeah, that's helpful to hear, and that's a good thing to open up here. As you're looking at your state-specific results, or is there a way to display it more fully that gives you that range of where you are across all subdomains or across all domains?
Yeah, because it says the range is between 2 and 10, but if you look in percent of community water systems, I'm looking at the environment one, you have like 94%. So I'm kind of like, okay, where are we at with that? And which of the organisms you're tracking? The result is 11. Well, 11 out of what if the range is only 2 to 10? So I'm kind of, I don't know if I'm reading this correctly.
Which state are you in, if you don't mind my asking? So we can
I'm in Alabama. I just went to the first state.
All right, excellent. And that's important because, well, for a couple of things. One of the issues you're raising is a methodological issue, which is about the how the index numbers were arrived at around things. And Mike may or may not still be on the phone. I'm not sure, but around the way the index has been put together. Historically, is the measures are averaged within the subdomain, the subdomains are averaged within the domain, and then there's the average leading up to the state score, which can, in fact, skew it such that certain measures, if there are 3 measures, let's say there are 3 measures in a subdomain, those measures are going to end up counting more in the final score than if there are 20 measures in a subdomain, right? So as you roll those up, that does create that challenge, and that's some of the methodological work that's going on right now. We're looking at scaling and weighting. Those are some of the issues that the Delphi panel will be looking at. Mike, are you still on? Can you say a few words about that?
Well, and
sure.
let me jump in a little. I'm sorry. Go ahead, Mike.
So there are a lot of issues. I think that the one that you bring up about the possibility of some measures or some domains skewing the state average is a legitimate concern. That happens. I don't know, and so as Anna described, we're trying to minimize that, and I think that we're going to implement some changes to the next version of the index that will accomplish that. But yeah, I get the fact of the matter is that with this kind of exercise, that's always going to be a possibility, and I'm not sure that there is a good way to, or even if there is a way to eliminate that possibility.
Oh, and again, I think this is
I guess my only thing would be I would like to highlight that because coming in from the outside, one of my things as a policymaker would be, oh, what's going on in my state? Are we doing good? And two things came forward, which is one, it looks like we're great in one area but terrible in everything else. So that shows the skewing issue. And then the second thing is the numbers. We don't know, like, what's the range? I mean, 4 out of 40 or 4 out of 100 or 4 out of 10? So those are the kind of things that I would think of as a policymaker looking at this, who's trying to figure out where are we lacking and what should we improve on.
Doug, if I hear you right, I'm hearing that there needs to be some kind of visual that you can look across your state and get a feel for how it is. What's your results for all the subdomains and how that compares somehow to the national average or something with that.
Well,
do you have a more of a global picture of it?
Yeah, and I think you provide the state summary here, which is very good. That but when you dive down a little bit, it's just I'm not going to say it's confusing. It's just uncertain about what does this really mean. Are we good? Where are we lacking? Is there one thing we're really good at, but other things that we're bad at? So yeah, because you give these numbers, but it doesn't say what's the range.
What's the context there and the range it is, and how does it compare to most other states in the nation or my region or that kind of thing?
Yeah, and I wouldn't even go that complicated. I would just simply say, instead of just saying 4, saying 4 out of what? Or 11 out of what? Out of a possible whatever.
Right, so it's like 4 out of 10 or something.
Yeah, just so they understand that that's where they're coming in from. And, because I think the other thing is, when you double click on it and you get down the measure name and the rationale, data source, that's great. That really gives some really good information for them to drill down to. But the result is a little bit just, I'm not even going to say confusing as much as baffling. We just don't know what does that mean.
Mm-hmm. Can I ask a question about that? If we're thinking about sort of the next iteration, would it be helpful to be able to see, instead of one map where you drill down on the state and you sort of get these returns for each state, would it be helpful to be able to see the entire map by category so that when you're looking at just health security surveillance, you can see the entire United States with different levels for that state, so you can kind of look at it that way and then have sort of a summary that comes up on the side about what that means so just for health security surveillance in particular, what that range is and what it means if you fall within a certain range in that number. So you're kind of like breaking it down a little bit further. So you have this overview map and then you're able to click into the different sections and see the map just for each category, if you know what I mean.
Well, that'd be wonderful. I don't know if you want to go into that much detail, but I think it would be helpful from the policymaker point of view, because they're always curious about where they compare with everybody else.
Right. Yeah, it might be some sort of, that we can just add a series of filters onto the map so that it's returning different information instead of just having one map that to look at your state and kind of like memorize the numbers and then look at a different state and check those numbers and compare them, whereas if you had some sort of filtering system, you could get a visual about each category pretty quickly.
I would also add, if it would be helpful, you know, if you go to the page that is just the index, the national index, and you have the heat map of the states, would it be helpful to have that heat map on all of the state pages as well in some way? Because as it stands, you would need to look at the state, and then you would have to back out and go back to the index, I believe, to really get a sense of where that stands with the other states. But is it an issue, partially an issue of that needs to be more available across the site, that heat map?
Yeah, I mean, I think sorry, go ahead.
I just say, yeah, I like that direction if you can do that, because these heat maps kind of really dictate, you know, which direction the state is, where the state compares, and if you got it broken down by category, that's even gives them more information and more detail.
Yeah, I find looking at the subdomains within a domain, something visually with the subdomains, and then how those compare elsewhere helps, because it does at the domain level, as that brings up, it does kind of go things to the mean, obviously, because the way it's designed, and it doesn't tell you much in terms of how am I doing with this subdomain versus that subdomain, and it washes out the details. So I do think that there's a way that we could somehow both look across a subdomain more visually, or across the domain more visually, and then also has something that does, as you're talking about heat maps or other kind of things, compare it to, across the system a little more. Yeah. These are really helpful. I'm realizing that we are right around 2:30 here, so I just want to do a process check. Would this be something that would be helpful if folks kind of went through the questions that Anna sent out a little more methodically and the site a little more methodically, and we really put next time's call to having some deeper discussions around some of these really creative ideas that are coming up? Or is there a better way to send ideas forward in the interim, or what's the best time-wise for you, Anna and Emily?
I would think maybe we kind of, I mean, of course, if anyone has ideas, I think we should all, you know, kind of share them before they slip away. But one idea is to kind of set up some sort of shared document where we have categories on the different pages, and everyone can sort of drop feedback into the different, you know, if there's something, we can break it down by homepage, by index, that sort of thing, and maybe we can all share it and just have a collaborative document of feedback, if that is something that might be helpful.
Yeah, that'd be good.
And maybe we could also do one there that's kind of a high level in terms of usefulness for your audience, and, you know, what's most useful, what's not as useful, or, you know, a high level one in terms of like usability, in terms of how easy it is to navigate and that kind of thing. So both some detailed ones, but also some kind of higher level ones.
Yeah, that might be helpful, because then we can, you know, as people have time to sort of spend with this and you know, contribute their ideas to this document, then on the next call we can kind of pick the ones that we feel like we need to talk about a little more in depth and work that way.
That sounds terrific. That can help us. That can really help complement the quantitative feedback we're going to be trying to get from you all in the piloting of the use, usability, and usefulness survey. So we can have both quantitative and qualitative data to really help us inform these discussions.
That'd be great. And Kathleen, I know you were jotting notes down. Any key themes that you heard today that we want to make sure we kind of capture as we move forward? Some of those?
Yeah, so I'll just sort of just summarize what I heard, just not take too much time here, but in terms of the tools and resources, it sounds like we need to make sure that there is a better linkage to those from wherever somebody is looking at results, specific to their state or whatever, but that we need to make sure that that is accessible and that we have made it clear who the tool is intended for, the particular audience. And then in terms of results, the way I would describe it is that they're coming across as bald. so there's without the context for the results, it's just really hard to know what it means. So, and then when you don't know what it means, it makes it less useful. So there's some kind of ambiguity regarding that until you go down further into the measure details. So some of the ideas were adding some filters and looking at that and looking across the domain visually in the same way that we can do that with subdomains. And then it sounds like the solution for gathering more data was to have some kind of a collaborative document and give the work group members some time to go through this exercise and then report in on the document. That's what I have.
Great, thank you. The document they were talking about
with everyone that was on this call, and we can just all sort of collaborate on it.
That's super. So folks could then kind of use the questions Anna sent out as kind of the framework behind which they look at the index sometime over the next few weeks and then get some feedback started with those documents.
Yeah, I think I'll just give every sort of participant a line under each sort of big question, and they can fill in their feedback there, and then we'll sort of have different tabs to go through for each category.
Great. Does that sound okay to folks on the call here? Of your follow-up?
Sounds good.
Is that like a Google document you're going to put together? Is that familiar, or is that something different?
Yeah, does Google document work for everyone, sort of like a Google Sheets?
Yeah, it works for me.
I think so.
If everybody you have to have a Google account to use it, right?
I believe so. So if that's a problem, we could do just a normal workbook in sort of a Dropbox type file or something like that. I think Google would probably work the best because it's sort of a living document.
Right.
But if anyone has trouble accessing it, or I need some different Gmail, email addresses or anything, we can work on that.
Well, this will be really helpful to have each of you look at it from your own constituency's perspective and really get a broader feedback. So as you start today, so thank you. This will be great. Okay. Any other questions or thoughts or ideas before we adjourn?
I do want to share with folks the next set of meetings, and again, if you were interested in the methodological or model development work that Mike was talking about on the call, please feel free to drop in on any of these meetings, and the folks who are members of these work groups are always welcome to drop in on ours as well. These are open meetings, so please take advantage of them.
Sounds good. So the follow-up things are everybody will review the website. We'll all review the website there and work on those questions. But then and the documents that Emily's talking about getting out. And then the other reminders were that if you've got ideas yourself or somebody else that would be great for serving on one of the panelists for the Delphi survey, please share those with us. And if you want to be a beta tester from the perspective of communication, looking at that survey, let us know. And then probably you may see the U3 survey pilot come out in the next month or so too. So an active time, no doubt. But your input's really, really helpful and important. So thank you. Anything else, Anna?
I think that covers it, other than to thank you, Kathy, and to thank Kathleen for all of the work you put into the questions today and facilitating the group. So thanks, guys. We'll be talking in a month. We'll be getting you lots of emails between now and then, and we do appreciate your input. Have a great afternoon.
Thanks.
Thank you.
Thank you.
Thanks, Anna. Bye.